Hi, my name is Kimiko Agari,
And my name is Christy Agari.
and you're here today with the Oral Surgery Sisters podcast. So today we are very fortunate. We have a very special guest because he is an old friend of both of ours, Dr. Alan Huang, and we're actually here today in Los Angeles at his practice Faces. So Alan practices here at Faces in Torrance, California. Alan, can you tell us a little bit more about your practice here?
Yeah, well, first of all, thank you guys for having me. It's been a really long time since I've seen you, Christy. Obviously, we all train together, but it's great to kind of get everybody back together. But Faces we started about a year ago now, and in the last year we've seen tremendous growth. It's been very slow and organic growth, but it's a passion project for a lot of our partners and myself included. We initially started it because we wanted to bring together a group of doctors who really could provide full scope oral surgery to the community beyond the dental alveolar component, really kind of dabble in more orthognathic surgery, TM joint reconstruction, trauma. We wanted to do it all for the community down here in the South Bay. So it's been about a year now, but it's been a great experience so far.
Yeah, and this is actually the first, I've seen this office before any of this design was laid out, before there were chairs, before there was equipment, and this is the first time that I've actually seen the office. And the second I walked through the door, I just felt so proud because I know you and I know Kyle personally.
Yeah.
And we go way back. And so I just feel so proud of both of you for how far you've come and how far this office has come. And for me to watch that growth happen over the last, I guess, year. It's already been a year.
Yeah,
That's crazy.
this whole thing started years ago. I mean, we started talking about this probably 2 or 3 years ago. And the whole build out process, it took a little bit of time, especially with COVID.
Yeah.
It was hard to get the contractors, hard to get all the materials, and ultimately finding the right architect and building the right team to really get this off the ground. It was, it took a little bit of time, but we wanted to go for a clean aesthetic, and so very minimalist.
It's gorgeous.
Type of vibe. And so
yeah.
it's nice to see kind of everything come together.
Yeah. And I think another thing to highlight is exactly what you said, where most oral surgery private practices or offices, their primary and maybe only focus is dental alveolar, treating dental alveolar patients. But when you say it's a full scope practice, it really is a full scope practice. Obviously, you have fellowship training, and each of the oral surgeons that work here are actually also in academics.
That's right.
Can you talk a little bit about each of your backgrounds and where you're all at?
Yeah, so I'll start with myself, I guess. And so obviously I trained with you guys. I went to school at UCSF for my dental school training, and then I went to USC for medical school and residency. And then afterwards, I went up to Stanford and completed a sleep surgery fellowship, which fell under the ENT umbrella. And it was really kind of an interesting place to train because it really was the bridge between what we do as oral surgeons and what our otolaryngology colleagues were doing in the sleep arena. And so I finished my training, and then currently the chief of oral surgery at Los Angeles General Medical Center, where all three of us did our training. And my two other partners, Kyle Yip and Eric Crum, they're the chair and program directors at Harbor UCLA Medical Center. And so it's interesting because the three of us are all involved in training residents, right? And so I think it gives us a little bit of perspective on the types of procedures that we do and also the breadth of, the scope that we can offer, right? And so being a part of these, bigger institutions, it keeps us, within that wheelhouse of all the things that we're able to do as oral surgeons and provide that to the community here. So
Yeah, it seems like because you guys are all a part of academic institutions, you guys are staying up with the latest literature, the latest techniques, and you guys are discovering all the new surgeries too that are out there. And when I was training with you, we were able to do some of those like bigger cases with tissue engineering.
Right.
Yeah. But though you practice full scope, there are some offices that practice full scope, but I really do think your guys' specific office is super unique because you bring that sleep surgery aspect to the community.
Yeah.
I find myself that back in Las Vegas, I find some patients that are really in need of a MMA or just some type of sleep surgery procedure that not just someone that someone who didn't have fellowship training may not be able to do. And so I find myself pulling up your website and like, I really think you need to go to these guys over here. But with that said, sometimes explaining sleep surgery to patients is a little difficult. And even some of my general dental colleagues, they are not quite familiar with, well, like what is sleep surgery, but what's sleep medicine? Like, how would you counsel maybe a general dentist to go about navigating like sleep surgery and sleep medicine?
Yeah, that's a great question. So, a couple years ago when I was deciding if I wanted to do fellowship or not, I felt that sleep surgery was a very unique subspecialty within this greater, umbrella of oral surgery that I felt we were uniquely positioned to basically take over. And I think it's important that the difference between us and sleep medicine and our ENT colleagues is that we have a dental background. And a lot of sleep issues are rooted in the cranio and maxillofacial, development, right? And so I think from our standpoint, we're, positioned very, very uniquely to understand that. And as surgeons, how do we augment anatomy to better support the airway for patients who struggle with sleep disordered breathing? And so, when we talk to our sleep medicine colleagues or our general dentists, we are really the people that understand both arenas, right? The growth, the soft tissue, the skeletal component. And I think that's what makes us special, right? And so a lot of the general dentists, the pediatric dentists, the orthodontists, they're now starting to realize, how important sleep is and, what to look for in their physical examinations. Because I think general dentists especially, they're the ones that look inside the mouth and that is the opening to the airway, right? And so there has been this shift in terms of how we evaluate patients, looking at their tongue, looking at their tonsils, looking at, the wear and tear on their teeth from grinding, these parafunctional habits. So I think it's important, that general dentists are now starting to understand a little bit more about, the implications of sleep disorders and, where it all starts. So.
If a dentist suspects that their patient has sleep apnea, where should they send the patient? Should they advise them to go get a polysomnography first or a sleep study and go from there? How should they counsel them?
Yeah, so, anytime a patient comes in to go see their dentist or their oral surgeon and they're having any kinds of symptoms related to sleep deprivation, right? And we've all been there, right? We've all done the all-nighters. We've all had terrible sleep. Any of these symptoms, whether they're concentration issues, memory problems, just general fatigue, mental fog, what they ought to do is start with a sleep study. Whether that's an in-lab study or an at-home study, it's really important to get a baseline and see, well, first of all, do they have any obstructive episodes? And if they do, does that translate to some sort of hypoxemic burden, right? Because ultimately that's what's happening, right? So patients who struggle with breathing while they're asleep generally have a higher hypoxemic burden, meaning they have less oxygen flowing through their body. And so it's important to establish a baseline. And then from there, we can counsel them on, conservative treatments, CPAP, oral appliances, and certainly surgery. So, MMA, soft tissue surgery, hypoglossal nerve stimulators. Then we can counsel them on the different types of treatments that we can offer for them.
How does a sleep doctor screen if a patient should be sent to surgery? Are they ordering a CT max face in the hospital and assessing their airway, or how do they eventually get to you as the surgeon?
Yeah, and so, that's a great question. So right now, currently after you've been diagnosed with some sort of sleep disordered breathing, whether that's through a sleep study at home or an in-lab study, at that point, they will usually see a general dentist or an orthodontist, and conservative treatment is generally first offered, right? The unfortunate reality is a lot of treatment is dictated by insurances, right? And so currently, a lot of patients cannot even, really explore what surgery even is until they've failed CPAP, until they've tried the oral appliance. And certainly after they've failed conservative treatments, then they kind of, find their way to me. And at that point, I do a full physical examination, inclusive of a sleep endoscopy where I basically put patients to sleep, take a camera, look at their airway, look at what's happening while they're sleeping. And then from there, I can offer them different types of surgery based on the anatomy that they have, right? So if they have big tonsils, or if their palate is very, very small, I'll do a UPPP or a UPPP, open up the airway. If they are deficient in any way in the upper or lower jaws, we can offer jaw surgery for them. And so it really comes down to patient-specific interventions to basically treat the level and phenotype of airway obstruction.
Where do most of your referrals come from?
Yeah, and this is, I guess, something that I recognized early on. So, when I was choosing what fellowship to kind of pursue, whether that's cosmetics, orthognathics, sleep, I ended up choosing sleep because I felt that this was going to be the next big wave that would hit our specialty. And so currently, a lot of referrals are coming by way of orthodontists, right? And so a lot of patients go see an orthodontist usually to get their teeth straightened. And then more and more recently, a lot of parents are starting to recognize that a lot of their kids are mouth breathing, right? And then when they kind of explore that a little bit more, they realize that their upper jaw is too narrow. And then they want to expand the upper jaw. And then, along the continuum from someone who's maybe 5 or 6 years old all the way up to 20, 21 years old, usually that age group that is pursuing orthodontic correction of their crowding, a lot of times the orthodontist now is recognizing all these different problems. And when they see that, then they refer them to me, and then I work with sleep medicine, getting them a sleep study, and then, kind of doing that moving forward, and, how to basically move this patient along this algorithm that, for sleep issues.
Yeah, I feel like as an orthognathic surgeon working with a lot of orthodontists in the community, I have noticed that there are more and more orthodontists out there that do focus on the airway, or they're maybe not focus on it, but they're aware of it more. Right. And so they do include those notes in the referral. Even if the patient's doesn't have a diagnosed obstructive sleep apnea or has not had a sleep study, they do note that on the CT scan or the cone beam or imaging that they see lateral ceph. They note that, limited airway was noted on imaging, evaluate for a potential airway issue or sleep apnea. Yeah. And so orthodontists are becoming more aware.
For sure. I think as a whole, the dental community is far more progressive in their thinking. Yeah. When I compare this to our medicine colleagues, our pediatricians, there's still a lot of resistance to accepting that, a lot of times these issues start young, and it's not because they have ADD or ADHD, and it's not that they have depression. It's truly they just don't have good sleep, right? And it's hard for the medical community to kind of wrap their minds around the fact that it is an anatomic issue, right? And so to catch that early on, I think that's been a struggle to get the medicine folks to really kind of buy into that. And luckily for us, as more and more literature comes out, we're starting to understand a little bit more, and there's more buy-in from our medicine colleagues. But, presently, I do think most of my patients are coming from dental colleagues, right? The people who are inside the mouth and looking at that all the time. And for us too, again, our patients are getting cleanings every 3 to 6 months, right? And so, the relationship that our patients have with their dentist is a little bit different than the relationship that they have with their primary care, where, the annual routine physicals are, usually a 3-minute conversation and, get them in.
If at all, like most people don't, they just go in if they have an issue.
That's right. Exactly.
And if they don't know that they have an issue, like with their airway or sleeping.
It's so true.
Especially because I feel like a good amount of the population, everybody has bad sleep.
Oh yeah.
It's like that's what I would think as a layperson. Like, I'm not sleeping well, I don't need surgery, but maybe you do, because there's so many things that play into probably or poor sleep that you as a sleep surgeon or another sleep specialist would sift through. Right.
And I think a lot of the patients who come see us here at Faces and even at LA General, there's always this aha moment, right? Where, because I spend about an hour with my patients during my consultation visits to really kind of break down the different types of reasons why they would be having sleep disturbances. And I kind of ask them for photos when they were younger. I kind of walk through their orthodontic records just to give them a sense of, okay, well, this has been a problem that you've struggled with, your entire life. Yeah. And it's not like it's just something that's coming to light now, right? This is something that you've struggled with, throughout the last 10, 15, 20 years. And only now are you starting to really see the long-term effects of sleep deprivation, right? And so a lot of these patients come in and they have this aha moment where it's like, oh my God, it finally makes sense now. This is why I've never been able to breathe from my nose, or this is why I just feel fatigue all the time. And this is kind of a side story, but, we did this surgery on a patient not too long ago, and this patient gave me the greatest gift of all. It literally handed me a bag of antidepressants and said, I no longer need this anymore, right?
Wow.
And it's surprising, like, if you have a good night's sleep, what that does to your day-to-day, mental happiness, right? And so, she handed me this bag of her antidepressants, and, she was like, I don't know what to do with these. Can you dispose of these for me? And it was such a wonderful moment for me, a full circle moment where it's like, okay, well, we don't always just, throw medications at patients, right? Because there's a stark difference between managing a disease and treating a disease.
Where do you see the future of sleep surgery as a specialty going? Because obviously sleep surgery as a field is more, I mean, not that it's new, but newer, especially in the realm of maybe oral and maxillofacial surgery. There's really not a lot of oral and maxillofacial surgeons like yourself who have gone through an actual sleep surgery fellowship.
Yeah.
Primarily it was our ENT colleagues.
That's right. Yeah. And I think that's a great question. So, I think that in the next 10 to 15 years, the goal as a whole is to really consolidate all the stakeholders, right? So right now, if you think about how sleep is managed, right? You go see your primary care, you get a sleep study, then you're referred to a dentist for an oral appliance, then you try the CPAP. You may or may not be sent to an ENT. Then you're sent to the oral surgeon. There's all of these, places where patients can fall through the cracks. And I think the future of sleep surgery is really going to be consolidation of all of these key stakeholders, where a patient can really just go to any number of clinics and they can be evaluated, anatomically, physiologically, and then figure out the game plan for them, right? And so I think, as the ENTs and the oral surgeons start to, cross-train each other, we'll have a better idea of, what to look for. So now ENTs are looking at the palate, they're looking at jaw structures, things that oral surgeons usually look at. And now oral surgeons are looking at the airway from a soft tissue standpoint, looking at the tonsil size, looking at the endoscopies. So I do think this cross-pollination between the two specialties is going to be the future. And obviously how the sleep medicine folks will play into all that too, understanding the physiology of sleep, and how surgery can impact that.
Yeah, I think because I visited Stanford as well, the Stanford sleep program, and being there, because I had talked to you about it beforehand, but actually being there, I see exactly what you're saying, where it's the field is very multidisciplinary, as much as maybe it's not as much as it should be. But when you go to Stanford and you see what they've developed there, that is what it should be. It's kind of similar to cleft craniofacial,
100%.
where there's cleft craniofacial multidisciplinary centers, academic centers, hospitals, where all of these different specialists come together from their different backgrounds, both from the dental side and the medical side, and they treat these patients together. And I think there needs to be more of that. And it's probably primarily at Stanford, but to figure out how to get that model in different areas of the country and in different areas of the world.
Yeah, I do think that will be, the goal, right? So, as time goes on, sleep centers will really kind of be the new cleft craniofacial centers, right? Where they bring in all of these specialists to really take care of these patients. Obstructive sleep apnea is something that is very, very prevalent, as you know, with tremendous implications on economic burden, healthcare burden. So I do think that, in the next 10, 15, 20 years, all of these sleep centers will start to come together, bring in our ENT, oral surgeons, sleep medicine, everybody under one roof. So.
Well, there's for sure a need. I mean, that's what everyone wants, is just a good night's sleep.
As my mentor once said, find me someone that doesn't want to sleep better. All of
That's
us,
true.
all of us want to sleep better. So, yeah.
So we all did the 6-year program at USC, and that means that we all obtained our MDs. My practice is very different from what the both of you do. I'm very much more in a traditional private practice sense. My MD, it definitely helped me personally during my training to obtain that medical knowledge. You definitely don't have to get the MD to be a fantastic oral surgeon. But with that said, your guys' practice is very different. Do you feel like doing the 6-year track helped influence your guys' pathways? You both did fellowships.
Yeah. I don't know, Kimmy, maybe you start. Yeah.
Yeah, so I agree with Christine that there's like when you're applying for dental school, that's the big question. Sorry, a dental when you're a dental student applying for oral and maxillofacial surgery programs, are you applying for 4? Yeah, are you applying for 4 or 6? What are you going to do?
Yeah.
And I think, I mean, I agree with you that for most oral and maxillofacial surgeons, if you're going to go the more traditional route and practice in a private practice setting,
Yeah.
then you either way, if you do the 4 or 6 year program, you're going to be a full-fledged oral and maxillofacial surgeon. For me personally, and this doesn't apply to everybody, but for me personally, I do feel like doing that 6-year track and obtaining my medical degree was very beneficial.
Yeah.
So one, I would say I did my fellowship in North Carolina. If I didn't have that MD, I actually would have been very limited and probably wouldn't have been able to do that fellowship because of more of the licensure. When I was in North Carolina, I actually practiced under my medical degree because of the dental licensure exam that I took. Yeah, there are restrictions and I wouldn't have been able to readily obtain a dental degree there unless I probably retook a dental licensure exam. So because of that, I would say it definitely helped me, allowed me to pursue the fellowship that I wanted to go to. And then afterward, I do think that it also helped me get to the position that I am now and the job and career that I have now. My goal was always to practice more full scope oral and maxillofacial surgery, to do orthognathic surgery. That's what I did my fellowship training in. Mm-hmm. And so currently I work in a hospital-based oral and maxillofacial surgery practice. And I do feel that because I'm working in the hospital with other medical doctors, other physicians who have an MD, that it helped in me getting that position and then also just navigating the hospital system. Yeah. So I think overall for me personally, because of my goals, it was very beneficial. But of course, that's not for everybody.
Right, right. And I think, yeah, to your point, I also did a fellowship. And, where I did my fellowship, it was under this, bigger umbrella of an ENT program, right? And I think the medical degree from that standpoint, it was almost like you spoke the same language, right? Because, to a lot of our medical colleagues, oral surgery included, dentistry as a whole is a very, very kind of mysterious place for them, right? And you guys know this. I mean, we went to medical school and it was a 1-day lecture in our GI track, which was like
barely.
There's 32 teeth in the mouth. And I remember at that time, a lot of my medical school classmates are like, "You guys went to 4 years of school for this?"
Yeah.
And it's that's the true extent.
Yeah, they were like, "We know it all now."
That's right. So
I can be a dentist.
That's right. So that was like the extent of their knowledge as it pertains to dentistry. And I think for me at least, there's, in theory and what's in practice, right? In theory, it does make a difference whether you have a medical degree or not as far as your scope of training, the types of surgery that you do. As oral surgeons, between a 4-year and a 6-year, with and without that medical degree, it doesn't matter, right? And you guys know this, the types of surgeries that we do are exactly the same. But to the patients and to some of our medical colleagues, having the medical degree did kind of even the playing field in some ways, where you spoke the same language as them, and and suddenly they understood you as being a part of the system, right? And fitting into the ecosystem is a very, very important part, from our patient standpoint also, right? When I went through my OBGYN rotation, I didn't have my medical degree. And I remember I was delivering this baby, and imagine what goes through a mother's, mind when the person helping deliver this baby has a DDS, right? And she's in the middle of labor. She's like looking at my name tag. She's like, "What is going on?" And
Are you a dentist?
Exactly, right?
Wrong hole.
And so it's like, wait, hold on. I know what you must be thinking, but it's not what it seems. But at the end of the day, having the medical degree, working within a hospital does have its perks because suddenly it's, again, you're recognized as being part of that. Whereas the single degree, because I went through it before I had my medical degree, it made it a little bit more challenging for some patients to understand, what is exactly that you're doing.
Yeah,
right?
it's a little political.
Yeah, it is. So, But yeah, if I could do it again, I would do it again for sure, right? I think the medical school curriculum gives you a foundation that you can really build upon. And some of the guys out there don't need that, but for me personally, it was a really, really nice thing to have, to speak the same language, to go through the core rotations, to see what's out there. So,
Yeah, I think if all three of us went back, we would choose the same path.
Yeah.
But I think if you're applying for oral surgery residency programs, it's really just an individualized decision.
100%.
You have to figure out what's best for you. Of course, with a 6-year track, there's additional costs that you incur just because of medical school, especially at USC.
Yes. God.
Not the cheapest. So it's an additional 2 years.
Right.
Not everybody may want to do that. It is a long track, so it's kind of, you have to reflect on what is best for you.
That's right.
The way that Ellie, one of our guests on the podcast, the way she spoke about a non-cat is almost how I feel was my experience going to medical school. So she spoke about her non-cat as being a year where it really prepared her, trained her, matured her to be a great resident.
Yeah.
And I almost feel that way personally for medical school and being more attuned to being a good resident after those medical school years. So after dental school, we had 1 month of internship. We would go from like a dental school setting to just like being in a hospital, not knowing where anything is, not knowing how to put in orders, not knowing like how to do a consult or anything medical. But you are expected to know how to do those things. Like they don't treat you like a dental student when you start oral surgery residency. You're an oral surgery resident. And so it was really shocking just going from dental school to just 1 month of like, what the heck? Like, I'm not a medical doctor, but you have to conduct yourself. So, and then I went to medical school, and it helped me personally just learn medicine, take things in like a digestible way for me. I've seen some residents just be able to pick up medicine just on the spot. Like, oh yeah, I just went on this one rotation. I learned everything about how to run a SICU. And it's just like, are you kidding me? Like,
and they just graduated from dental school.
They just graduated from dental school. That's just not me.
For sure.
So the medical school really helped me be a better resident in the hospital. And so from a personal experience, that was the right decision for me.
Yeah, I remember there's that difference between when you're an intern and we're all familiar with the USC track being an intern right out of dental school, and then when you come back and you're on gen surge after med school. I remember one of the first pages I got was something super simple, like hey doc, like a page from a nurse, hey doc, this patient on the floor has an elevated blood pressure. And it's on repeat checks, it's still elevated. And then I remember I was panicking, like, and you already know, because in dental school you do go through medication lists for patients. Which antihypertensive, like, okay, this is saying I should give 10 of whatever, of like hydralazine. And then you're like, is that okay? Am I gonna kill this patient? Is that safe? And then when you come back when you're on gen surge, you're like, okay,
we got this.
Fine. But something really benign like that initially is very scary when you've never worked in the hospital and you've never managed patients on the floor.
Yeah, I agree. The medical school definitely gave you, a little bit more of a foundation to kind of build your residency training on. So again, for me, I think I would have done it over and over again. So.
I agree.
So Alan, obviously you wear many hats in the oral surgery community, but one of the first hats that I have known you to wear is that you were my mentor. And you're a very big mentor in the oral surgery community.
Like, I have known you for a long time now. Like over a decade. But I met you in dental school, and really same thing. I was a baby dental student. I had a little interest in oral and maxillofacial surgery, and then you were in the class above me, and you were already on your path to pursuing oral and maxillofacial surgery. And so you really became somebody that I looked up to. You know that I always call you my big brother. because you were always a role model and inspiration, somebody that provided a lot of guidance as I went through the path of, okay, I'm interested in oral surgery. What's the next step? What do I do?
Yeah.
And you pretty much instructed me through my entire application process. And then since then, we've really just had a lot of overlap in our training. Obviously, we both were at UCSF and USC together, and then even now as oral and maxillofacial surgery colleagues.
Yeah.
And so you started off as my mentor, but through the years, I'm fortunate that you have just become such a good friend to me.
Yeah.
Still an inspiration, still a mentor, still a role model,
Yeah.
but I'd like to think of myself as the original mentee. But
were?
since then, maybe Christy was the second.
Maybe.
But since then, you really have become a mentor to so many people. And when I say that, I mean like people who are currently in high school, college, because you do a lot of outreach.
Yeah.
But even people now that have finished oral surgery residency and are oral and maxillofacial surgeons.
Yeah.
Yeah, there's
And
many
so-
oral surgeons out there because of you. Probably
Yeah.
as I was thinking, okay, across all the way to the other side of the country, but you have mentored people even like in Korea, so all across
other
the globe.
countries.
Yeah.
And so I think it is important to highlight for you.
Yeah.
Yes, like Christy said, you wear many different hats. You have different roles in the oral and maxillofacial surgery community, but you are. It's important to highlight that you are a mentor to a lot of that next generation of oral and maxillofacial surgeons, and not everybody is like that. Like I think people forget that as surgeons and like for example at county and attending a chief resident,
Yeah.
they're so busy during their day that if there's somebody coming, like let's say an extern,
Yeah.
that extern is not getting any communication from the
sure.
chief. Like some people just aren't that way, and there's just when there's a million things to do, that's
Yeah.
the last on their radar, and they're not going to have time to, let's say, chat with that extern.
Yeah.
I guess what is your advice for people that are interested, like younger, let's say a dental student,
Yeah.
who's interested in applying and going down this route for finding mentors or making those connections to get them to the next step?
Yeah, no, they're great points. I think, looking back, I started this journey back in 2011, right? When I first met you guys,
crazy.
it was like 2012.
That's crazy.
And, looking back, I think mentorship has been such a key part of not only my journey, but who I am today, right? And it's such an amazing thing to not only find the right person to mentor, but to find your own mentors also, right? And there's a big difference between being a good teacher and being a good mentor, right? A mentor is
absolutely.
truly someone who will tell you where to look, but not what to see, right? A good mentor will basically get the best out of you, right? They inspire you to be better. And I think for me, that's been such a big part because it really gives you purpose to your job, right? Now, certainly as surgeons, you do the surgeries and you make changes in people's lives and those kinds of things. But I think it's equally important to bring up those around you, right? And, luckily for me, I had both of you guys. And the reason why, in my opinion, the highest job satisfaction is because not only do I get to do really cool things, in surgery, but I get to be doing this with all of my friends, right? And that's something that you don't get to build overnight, right? This is something that happens across time. And I think the sooner you realize that, the better off you'll be because, the people you mentor today will be your colleagues tomorrow, right?
True.
And, everybody has strengths and weaknesses. And these days I can call on any number of the people I used to mentor. If I ever run into any issues, whether it's in surgery, whether it's patient care, whether it's personal favors, these are all people who would do anything because at the time when they needed something, I gave them 5 minutes or 10 minutes and mentored them. And so for me, it's like the best thing I've ever done is to continue to give back to the specialty and give back to the people because in the end, it's paid out in ways that I can't even imagine, right? And so my advice, I guess, for aspiring dental students who want to be oral surgeons is to latch onto somebody, and whoever this person is, they have to inspire you to want to do more, right? And that's the truth, right? This person, whoever that ends up being, it could be me, is that they can't ask for anything in return, right? The greatest mentors in life are your parents, right?
Yeah.
And your parents are people who give you everything and ask for nothing in return, right? When's the last time a parent has ever said to you, hey, you remember that time I made a lunch for you when you were in 6th grade? You know, it's time for you to pay that back. Right? Of course, they don't say that, right? And that's what a true mentor is, when they're willing to give you everything but ask for nothing in return. And that's my advice. You know, find someone who's willing to do that for you. But mentorship, importantly, is a two-way street. It can't just be take, right? You know, a true mentorship is a two-way street. And so what you're able to give back to your mentor, and it doesn't have to be in the same capacity, right? Your mentor might be, you know, maybe helping you out with your research, or maybe helping you out learning a new skill. But it is of the job of the mentee to also give back to their mentor, whether that's by giving them their time, whether that's by also mentoring someone else. You know, I always tell, you know, people who I've mentored in the past, like, you don't have to thank me for anything, but do this for someone else, right? Find the next person and help them the same way I've helped you. And that's to me, that's all that matters.
That's so true. And I think that this is a representation of that, because like we said, we've both been your mentees in some capacity. And as a result of that, I really do think seeing you over these years and seeing how passionate you are about that and giving back to that community has made both of us become inspired to do the same thing. I mean, that's partly why we started
this podcast. That's right.
And partly why during residency, Christy and I would reach out to other younger, specifically women, let's say in dental school or younger residents, to gather this group of this community together and do that outreach and see if there's
it's important.
anything that we can do to support that community. And I do think, and I feel strongly that the reason we both are passionate about it is because we had someone like you who's passionate about it, and it's very, very rare. Like, there really are not a lot of surgeons, oral surgeons like you, who even want to spend that extra second. And it's not a lot of time that is necessary. Like you said, it might be 5 minutes, 10 minutes of just upon quick meeting, let's say an extern or somebody shadowing or somebody that sends you an email, something like that. It's just a few minutes, but those few minutes make a huge difference.
Oh, for sure.
Especially for me, if I go back and think about when I was a dental student.
Oh man,
shadowing an oral surgeon, most of them, you know, they don't have time to talk to you.
Nobody has time. Right?
Nobody has time. And so, but if you think about the people that made a difference in your life when you were young like that, it is those people that just took a few moments of their time to reach out to you and inspire you. And so I think that's basically what all three of us are here trying to do.
Yeah, totally.
What really made you, one of the many things that made you a great mentor to someone like me or Kimiko, and the fact that we were women, is that you never treated us like we were a female resident, like, oh, those are our female residents or those are women. You always just treated us like we were regular residents, and it doesn't matter who you are. You expected great things out of everybody. Do you have any advice for any female residents out there that might be having a hard time or just need some advice?
Well, you two are very different, right? In a lot of ways, because and this is just my personal opinion, is that I meet a lot of women in surgery or women in medicine or women in dentistry. And for some reason, there's always this, they feel like there's a target on their back, or they feel like there's a chip on their shoulder, something like that. And the truth is, I use both of you guys as examples all the time, is that if you don't try and overcompensate for something, you know, people don't have targets on you, right? And you guys were some of the most phenomenal residents, two of the smartest people I've ever met in my life. And never once were you like, oh, like, you know, oh, I'm being treated differently because I'm a surgeon. I mean, people respected both of you, incredible respect for both of you, because you guys were just amazing residents, right? And I think my advice to women in surgery and women in healthcare is that you are just as good as everybody else. And as long as you understand that and you work hard, people will treat you the same way as everybody else, right? And you guys are the shining examples of that. You know, because I've worked with other residents who are females, where they feel like they are being discriminated against because they're women. And from my standpoint, I'm, you know, thinking to myself, you're being discriminated against because you just aren't good right now, right? And this would happen with
we
guys,
know exactly
too.
what you're talking
right?
about.
You know what I'm
Yeah,
saying?
yeah.
So,
Yeah.
but I just think that you guys were such amazing residents that you never had to even fall back on that, right?
Yeah,
So,
that's a really good point though, because I think for me, going through residency and just training in general, of course, if I'm not thinking about it, I'm always kind of subtly aware that,
Yeah.
yes, we are women. There's just less women in oral and maxillofacial surgery residency programs in the field, in surgery in general. I'm aware of that, but it's not necessarily something that I'm always bringing to the forefront in my daily practice, unless some sort of situation arises where it's kind of placed in front of my face.
yeah.
But I think I don't know why that's how I am. I think every woman is different.
Yeah.
But I would just go through residency and I wouldn't necessarily be even thinking of those things. But I think some people do, perhaps, for whatever reason, and everybody has different background and experiences.
Yeah.
But I think that obviously helped us go through residency
Yeah.
where there's less women. It's not ever something that I actively thought about every day.
Right. And that's why
Yeah.
people love you guys,
I-
right? Because it's never been, you guys never used
don't
it as
know.
an excuse.
Yeah,
right?
it is straight. I don't know.
I do think
understand.
a good part of it though is like a chief of oral surgery like you, and before you became that as an attending at USC, you did create that environment for the residents.
Yeah.
And I don't know that every residency program is like
That is
that.
true.
Yeah.
But at least at USC, you made the playing field the same.
Yeah.
And so then it was our time to, not take any special treatment, just
Yeah.
do the work, do hard work, do good work.
Yeah. No, I mean, and both of you were the same. Truly were just incredible residents. I mean, to this day, I miss it all the time because, some residents.
It was fun. I know.
It
We
can
had
come back.
fun.
Yeah, it can come back.
We had fun.
If your mindset is to go to work every single day and just be better than you were yesterday and to put your head down and work hard, nobody ever says, oh, it's because you're this, that, or the other, right? And that's what you should be striving for, right? And you guys have just done such an amazing job.
Thank you.
Yeah.
Thank you. And with that said, say you are doing what you're supposed to be doing. You are going to work. You are doing hard work, difficult work, putting in the time. And maybe you are you realize, you know what, I'm doing everything I'm supposed to do. And I am experiencing a discrimination.
Yeah.
At that point, you did everything you're supposed to do. And you can raise your voice and you can say something.
Yeah. I'm not saying that, because I think in healthcare and in all types of, work settings, discrimination will happen, whether you're a girl, whether you're a boy, whatever the case may be. But, for me, it's just, if you just focus, on being the best surgeon you can be, nobody can ever fault you for that. Right. And so, I think it's important to recognize that, especially for the younger generation who's coming up now is, your singular focus during residency is to become the best resident and the best surgeon you can be. And if that is your primary focus, then everything else will work out. So,
Yeah, and without making excuses. I think
yes.
when you are a resident, when you first start your residency, you really need to remember that you don't know everything.
Yes.
And that's normal. That's normal. That's why you're going through residency. And so you are going to make mistakes.
For sure.
And some of those mistakes will be your fault.
Yeah.
And you need to take ownership, like you said, whether you are a man, a woman, this, that, and you can't complain, you can't make excuses.
Right.
Because then that's when there will be a target on your back.
That's right. And you guys never made excuses, right? And that's why, I think we miss you guys all the time. Not to say that they're doing that now, but
Thank you so much.
thank you guys for having me.